Today I'm going to talk about ageism and how it affects older adults. So ageism is bias and discrimination based on age, and it affects older adults more than any other age group. And I'll show you how.
Hello there, I am Dr. Regina Koepp, and this is the Caring for Aging Parents show. I'm a board-certified clinical psychologist, and I specialize in older adults and families. I help you manage the most complicated situations with your aging parents so that you have peace of mind knowing that you are doing everything you can to help your parents live their best lives without giving up your own life in the process. So for the best tips on helping you to care for your aging parents, subscribe to my show and you'll get new tips every Wednesday.
So I want you to think about older adults in your own life and then really reflect and think, have I ever had any of these thoughts? She's so cute. He's surprisingly sharp. Isn't it time that she retires? He's doing so well for 85. Old people can't change. I mean, old dogs can't learn new tricks, right? Of course he's depressed. He's old. Of course she has dementia. I mean, she's old. What do you expect? Researchers study how people, just like you and me, view older adults. And here's what they found. Older adults are more often viewed as alike. They're all the same. Alone and lonely. Sick, frail and dependent. Depressed, rigid, unable to cope, and the list goes on. But these thoughts about older adults are actually totally inaccurate. And it doesn't stop there. Ageism plays out in medical and mental health care too. So studies show that 35% of physicians wrongly consider an increase in blood pressure to be a normal part of the aging process. Only 10% of older adults receive appropriate screening tests for bone density, colorectal and prostate cancer, and glaucoma. And 60% of older adults don't receive the recommended preventive services that they need. And as a result, older patients receive less medical and mental health treatment than their younger counterparts. I've even heard doctors say to me, there's nothing more that I can do. They're just old. So this takes a serious toll on older adults. In fact, scientists have linked ageism to cardiovascular stress, lower levels of self-efficacy, which is actually our belief in our ability to do something, decreased productivity, which means that older adults are going to be contributing less to the community. And probably one of the most impactful statistics is that ageism can actually shorten a person's lifespan. So ageism plays a huge role in how older adults view aging and themselves. Older adults who have a positive view of aging live 7.5 years longer than those who don't. And let me ask you, what influences how a person views themselves and their age? Ageism. So what can you do? First, I want you to make it a priority to identify and reflect on your own biases and assumptions about older adults. Awareness is key to change. And I want you to join me next week where I'm going to be sharing several strategies for correcting your ageist beliefs. So I'll see you there.
If this video was helpful, be sure to subscribe and don't forget to share this video with your friends who are caring for their aging parents, because nobody should have to do this caregiving thing alone. Lots of love to you and your family. I'll see you next Wednesday.